Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365, with your daily update for Tuesday. Is this still Tuesday? March 2nd. Wow. Already getting ahead of myself. So, appreciate you being with me today. We have a lot of news to get through. We got some COVID news. We've got a whole new public health order in Dane County for those of you in the Madison area. We got some news about some colleges and their response to COVID, and we've got several local news stories that aren't COVID related. One of which is a sort of local political story that the lesson of which I'll express a little bit of opinion on it. The lesson of which is why people stay out of it. Why people should learn when to keep their thoughts to themselves. That's an important skill that a lot of us need to learn still. So we'll get to that after the break. First, let's get into the coronavirus situation, which we'll do the state numbers first, and then we'll talk about the Dane County order, because the state numbers are pretty good with one exception. There's one set of numbers that I don't like, but most of these are pretty good. 324 new cases today. Again, 308 yesterday was the lowest we've seen in months. We haven't seen, I'm just flipping back through my spreadsheet here. We haven't seen below 400 since January. So 2 days in a row below 400 new cases is great. And that's, testing obviously is low because these are only new tests, right? These are only people who've been tested for the first time and testing negative, or who've tested before negative but are testing positive for the first time. Okay, so there just aren't that many people left who haven't been tested yet. So we're doing lots more. We're doing like 30,000 tests every day, but most of those are people who've been tested before because they're healthcare workers. They're getting tested every day. They're teachers. They're working at DW. They're students who are getting tested all the time. So only 2,400 new tests today and 324 positive. Our positive test rate for the past 7 days, that's like all tests in the past 7 days, 2.1% are positive. The last time we've been that low was almost a year ago, March 10th of last year. It's kind of the day before all the wheels fell off of everything. March 11th last year is when the NBA canceled the season, right? March 13th is when Governor Evers closed schools in Wisconsin. So it was right at the very beginning. There was one new case that day, 18 negative tests. Right, and the positive test rate for 7 days is 1.7. So we're at 2.1. That's great. Now, also, word of caution, grain of salt. In June, we were also just at like 2.5 at one point. We were kind of hovering around 2.5, 2.8, 3.0. And we let our guard down. Everything took a turn. Everything went crazy. In July is when we started to see cases start to go up, right? So don't take 2.1 as, okay, good, we can throw away our masks now, everything's fine. We're not there yet. Did I mention, our 7-day average of new cases also fell considerably. It's down to 575. It was just 610 just yesterday. So that's good to see. We're seeing fewer new cases. We're seeing a lower positive test rate. That's all good. We're also seeing a lower number of active cases. We're down to 7,263 currently active cases. Currently active being kind of a squishy definition. These aren't like, they're not testing everybody all the time to see do you still have symptoms or anything like that. It's just diagnosed in the past 30 days. 7,263. That's about 1.3% of all the cases we've ever seen. The other piece of good news today is we have blown right past 500,000 vaccinated people. As I predicted yesterday, we were at 492,000, and I thought today we'd get past 500,000. We did. There's 13,000 more people today, or just in the past 24 hours, have gotten that second shot. So we're at 505,123 now, completely vaccinated. Now again, we're still working with Pfizer and Moderna shots, which means it's a 2-dose vaccination cycle. The Johnson & Johnson's, which is the single-dose vaccine, are coming next week. We're going to get 47,000 doses of that next week. I am not sure how they're going to report that in the data. Will those go straight into the completely vaccinated? Will those go into the single shot? I don't know. We got to figure that out. But in any case, right now, we've got 8.6% of the population vaccinated. We're about a tenth of the way to where we need to be. We got to get to about 80%. We're getting there. And if it keeps accelerating, we'll get there, in a few months, one hopes. If we keep going at 5,000 a day, it'll take a couple of years. If we get 13,000 more today, 15,000 more tomorrow, 20,000 more next week, every day, we can get this done. It's mostly any slowdown is mostly a supply issue, right? We're still getting them from the feds. We're still getting them from the state. We're still getting them from the county. It's kind of inconsistent at the county level, but it's happening. We're getting it. We're getting there. We'll have to be a little patient. I'll have to try not to fight about it too much. There are hiccups in prioritization. There are hiccups in supply, but just like everything else this past year, we got to work through it together. The one piece of data that I don't love is the fatalities today. And it's not just the number that bothers me. Last week, Sunday and Monday, you might remember, we had 0 deaths. This is February 21st and 22nd. Then on the Tuesday, the 23rd, we had 33. We had 0 deaths yesterday and the day before, Sunday, Monday. This week, again, we had 0 deaths. Again, but these are deaths being reported, right? They're just not doing the paperwork as much on the weekends to confirm the death certificates. So Sunday, Monday, 0 deaths, not a surprise. So I thought we'd go up today. I thought we'd see double digits today to catch up. And we're at 28 today, actually 29 deaths reported today. And then 1 was taken out of the data. So the total death total goes up by 28 to 6,440. That's not as bad as it was last week. Last week was 33. Okay, because those are similar numbers, our 7-day average stays at 18, which is fine. What I don't love about these deaths is the ages. One person who died, and again, these seem to be a little catch-up data. These are people who passed away, over the past month or so. Some maybe even go back into like January and December. But one of the people reported today was in the 20s. One was in their 30s, one was in their 40s, one in their 50s, and one in their 60s. And then the rest, the 18, were in their, the rest, I'm sorry, the other 23 were over 70. So you expect to see most in that 70 and older range, or even 80 and older. But to see anytime we see a person in the 20s and 30s, it's like that's not that those people are worth more, or anything like that, but it's just a little bit frightening when you start to see that affect people in those younger age ranges. Okay, that is mostly what I have on the numbers. Let's talk a little bit about this new order in Dane County. This will just take a few minutes. If you're not in Dane County, don't go away because this is, you can get a sense as to how we're doing down here. Now, keeping in mind, Dane County, the positive test rate is even lower than the state. Right? The statewide positive test rate is now 2.1. And in Dane County, it's 1.7 or something like that. It's below 2. For the past 7 days, the county has averaged only 12 cases per 100,000 residents. As comparison, the state is at about 10, so very similar. 10 new cases per 100,000 residents. It's like a per capita thing in the state. In the county is 12, so very similar. But what's happening now is this is starting next Wednesday, March 10th. A lot of different things. They're going to also start measuring metrics a little bit differently. We don't need to get into that. It's a little in the weeds. But here's what it means in terms of what you're allowed to do now. Restaurants will be open to 50%. Indoor gatherings with no food, if it's just like a dance or a reception or something with no food, or a show, limited attendance to 350, not including employees. With food is 150. So you can have a 150 person wedding reception with food. But you have to still stay 6 feet apart, and you have to have a mask on when you're not eating. Okay. Outdoor gatherings can now be up to 500 people 6 feet apart. You can have outdoor gatherings up to 50 people with no masks. Taverns and bars can go up to 25% indoor dine-in capacity with approved seating capacity and tables and chairs at least 6 feet apart. So you have to get the Dane County Public Health to come out and look and make sure your tables are 6 feet apart. But if they are, you can have 25% capacity. So, what does that mean? That means, from a soccer fan perspective, that feels like you can have fans in the stands at 4 Madison games, 6 feet apart, up to 500 fans. But this is March 10th. The first game isn't until May. So if these things keep going, well, the next order could be 1,000 if things keep going. Now, but here's the thing. If things keep going the way they are, these restrictions can continue to be lifted. It's on us to make sure things keep going as they are. That means getting vaccinated when you can. And it means not going to big gatherings if you don't have to. Right? I mean, I get you can, and you might have to. But, for example, 50% restaurant capacity is great. I'm not going out to eat. I'm gonna continue to get takeout because I feel like I get what I understand. I don't disagree with this order necessarily, but just because you can doesn't mean you should, right? So I feel like just deciding, they're at 50%, therefore it's safe to go eat indoors at a restaurant. It's a little bit like, stopping the medication because you feel better when you're not going to medication yet. And if you have kids, about ear infections, right? They always tell you here's amoxicillin for the ear infection. Even if you get better, even if they start feeling better, finish the medicine all 10 days. I feel like we're on day 7 and we're about to stop taking the medicine because we feel better, right? So keep taking the medicine. Keep your mask on. Don't go shopping all the time. Avoid those big gatherings if you can. But, if you have a wedding reception or something like that to go to, go for it, have fun. But, a lot of us are still going to continue to remain cautious so that a month from now, we're not locking down again. I would love to see the the restrictions raised to 1,000 in April. I would love to see that, restaurants back at full capacity without me. Yes, take the medicine, not the Kool-Aid. This is a good question. I don't know very much about this. I did see the headline. Here's the thing. Wisconsin, you're not going to hear this about Wisconsin because Wisconsin doesn't really have any restrictions other than a mask mandate. But Indiana, Texas, I think Indiana maybe, or maybe I just saw some speculation about Indiana because I have some friends who are reporters in Indiana. But several states are just easing up many restrictions, including Texas repealing their mask mandate. Without knowing, I don't know the Texas statistics as intimately as I know Wisconsin's, so it's hard for me to opine about it. But it does, just generally speaking, it feels a little bit premature, especially for a mask mandate. Like a mask mandate is nothing. I don't know why people are so upset about masks. I genuinely do not understand the resistance to mask wearing, other than just you can't tell me what to do. Like resistance to offices being open, retail being open, or closed. Resistance to closing churches. I can understand because it's like imposing on your life somehow. Wearing a mask does not impose upon your life, so I don't quite get that. But I understand the desire to open things up. I think there might be too much of a hurry, and I think it might be counterproductive if we're not careful. But all that means is one thing I've learned this whole year is that if the government's not going to help us out, we can do it ourselves. We turn this thing around in November ourselves. Right? It wasn't a state order that when things peaked in November and things then started to turn and get better, the government did not help us get down to 2.1. We did that. And we continue to do that. So even though the county is opening up a little bit or condoning stuff that's could be happening already anyway, doesn't mean we all should just jump in and participate. So in terms of Texas, I really can't say much about Texas. I think it all feels just a tiny bit premature to me. Oh, and here's a good question too. No, I haven't heard anything about this. Except what you have, that there was going to be a vaccine registry, and it's not working apparently. Nor is the map. I still haven't. Well, and to give you an idea, I still haven't heard back about the map, and the map is still wrong in a bunch of places. So the vaccine map, I mean. But I think you can use the map as a starting place and just to make some phone calls and find out where you can get your vaccine if you're eligible. Okay. So let's take a short pause. Don't go away. I got the some job listings here, and then we'll talk about some local news, including the story that teaches us that white people should sometimes sit out. Don't go away. We'll be right back. If you didn't know we have job listings, we do. Madison365.org/jobs. And the thing is that people advertise with us because they know we reach people of color. So, that all of those employers that are listed in those job listings are actively trying to recruit diversity. So if diversity in a workplace is important to you, those are the companies you should go look to work for, right? And if you are an employer and diversity is important to you, which it should be, we provide a good service there. It's $50 a week to list an ad and get the video and social media and all of that. So let's talk about the the fun story for today. Brandi Grayson, you may know Brandi Grayson. If you're a Madison person, you probably know who Brandi is. She's one of our local sort of Black Lives Matter leaders. She's one of the founders of Young, Gifted, and Black, and going all the way back to Ferguson days, 2014, leading this Black Lives Matter movement here in Madison. And she is now running for common council against the current president, Sherry Carter. And Brandi kind of got into a little bit of hot water last week when another local activist posted something about asking who built the pyramids at East St. Louis, it's a place called Cahokia. It's an ancient indigenous site built by a group of people who we now call Mississippians, which are basically prehistoric indigenous people. We don't know what they called themselves. There's nothing in the way of records, really. But it's an important archaeological site. And he asked that question, who built it? And Brandi commented and said, Black natives. Now, you may or may not be aware that there is a, relatively, I don't know, just controversial is not quite the right word because it really doesn't usually upset people. But there is a there's a line of thinking and of understanding that Black Africans predate indigenous people here in North America. That's one line of thinking that African people migrated from Africa in boats like 50,000 years ago. This is not supported by any real evidence, but there are a few books and kind of line of thinking that support this view based on some sort of speculative and conjecture kind of evidence, right? There's also a strain of thought that holds that all life springs from Africa eventually, right? So even currently indigenous people can trace their lineage. You can trace their DNA basically back to Africa, which is two kind of different things. So this is discourse that happens on Facebook. Just people kind of make these claims and mention these various books that have been written. These various people who are on YouTube talking about this sort of belief, and but it usually doesn't go much beyond that. Right? It's not particularly contentious. It's just a thing some people believe, and it's kind of harmless. But in this instance, a white person decided to jump in and correct Brandi, and basically almost willfully misunderstand that set of beliefs, and that obviously, it basically was tone policing Brandi and telling Brandi that she was wrong and that she was being terrible to indigenous people, and and then Brandi got upset about that and made a Facebook Live the next day and kind of doubled down on it and talked a bit more forcefully about that set of beliefs. And then I got some calls from some indigenous people, and I was like watching this happen live on Facebook. Like I was like watching this comment thread unfold and not jumping in because that's not my place as a white person to tell Brandi that she's wrong about this. But these indigenous people are saying, like, she's on Facebook saying that Black Africans built Cahokia or the pyramids in Mesoamerica, and basically the idea, the sentiment I was hearing from these indigenous folks was, anything that good that we built she's trying to claim for some other people and trying to say that we aren't capable of that. So that felt hurtful to them. So I talked to some sort of experts. And I was like, what is the real story here? And the evidence and the scholarship, which, basically points to what we all kind of learned, that there was at one point 15,000 years ago or so, the where it's now water between Alaska and Siberia was land for like 5,000 years. People lived there. And when the water started to come in, then some people went back toward Asia and some people came over here. And that's kind of where indigenous people came from 15 to 16,500 years ago or so. That's what the scholarship says. But understanding that the scholarship is through a white lens. But, many native peoples, indigenous peoples did and still do have pretty dark skin. So there was a kind of, basically misunderstanding that Brandi did not intend to say indigenous people did not build their holy sites, their sacred sites, but rather that indigenous people did do that, but those indigenous people are descended from Africans, which still doesn't sit really well with a lot of indigenous people, but, well, why not? Like, what's wrong with being descended of Africa is what Brandi would say. Now, so I wrote this story. I tried to balance it as well as I could, because, again, I'm the white guy. I'm not going to be here telling, because if a native person posted on Facebook that the world was created by a turtle bringing up land from the bottom of the sea to build the continents, and we live now on Turtle Island, which is literally what a lot of indigenous people call North America for that reason, because it's their creation. I'm not going to tell a native person that they're wrong about that. I'm not going to lecture them about science or whatever. This is not my place. And it's also not my place to police a black person talking about their story. And that's one of the things that Arvina Martin, who's a Ho-Chunk Nation member and a current city council member, said we want to own our stories. We want to be able to tell our history. And Brandi's saying that's all I was doing. My version of my history differs from the version you think you know or whatever. But we're both just telling our stories. So there can be a dialogue, and there is a dialogue now. And Arvina still endorses Brandi for city council. And they had a respectful conversation, and they both gave each other books to read. But the thing is, it wouldn't have blown up into this big thing except for this white person decides to jump in. Had an indigenous person jumped into that thread and said, I disagree with you, there could have been a dialogue. So the lesson here, the moral of the story is know when to jump in and when not to. And usually err on the side of not jumping in if you're a white person. It's not on us to educate everybody. It's not on us to tell everybody they're right or wrong from our white perspective. Right? Does that make sense? So it was a difficult story to do because I'm trying not to take sides. I'm trying to navigate two different groups of people of color as a white person. So and I hope I was able to strike a balance. But it's on the site now. You can take a look and tell me what you think. It's at Madison365.org. Also on the site today, some much better and less controversial news. You might have heard of Young Rembrandts if you're from Madison. This is Karen Brown's business. It was an after-school arts program that unfortunately closed at the end of the year because the pandemic just devastated it too much. It was just too hard to do an after-school program virtually because the kids have been on Zoom for school all day, and you're going to make them stare at another screen. So she unfortunately had to cancel that, close that business. But she's an artist, and her husband Jonathan works in importing and exporting. So they have created this neon sign business with Karen as the artist, Jonathan sourcing stuff from China, and so you can custom order your own like neon signs to do for your business. I'm thinking I'm about this close to getting one of these neon signs for like right here. What do you think? Should I get like a Madison365 logo neon sign like right here? I think that would be very cool. But Naomi Wolf, our reporter, talked to the Karen and Jonathan and did a nice little feature on that business. They're very supportive of community stuff. Of Progress Center for Black Women has this big "Protect Your Peace" sign. There's a picture in the story. If you go to Madison365.org, it's a pretty fun business and a pretty fun, cool story about resilience and kind of pivoting and changing, doing something new when you run into difficulty due to this pandemic. So check that out at Madison365.org. Also today, Mellie Mills is a local food business here. Excuse me. Local restaurant, basically. And they are, it's Mellie Mills Soul Food. Obviously, with the restaurants being, the restaurant business being really weird this whole year, she's been doing a lot of catering. And so they have a GoFundMe. This is a local Black-owned food business. They have a GoFundMe going to buy a van for their catering business, which is they've been using this old Ford Explorer for many years, but with more catering than she's ever had to do before. She needs a bigger vehicle, so they're doing a GoFundMe. It's a community crowdsource to build that business, which is a beloved community business. It's not exactly a nonprofit business, but it's like almost like that. It's like people in Madison who love soul food love Mellie Mills. So check that out. Dave Dahmer has that story for us. It's at Madison365.org. Finally, a COVID story, another COVID story. Edgewood College and Marquette University also announced today that they have committed to in-person instruction in the fall, which means a couple of things. First of all, they're optimistic that the situation will continue to improve, and they're optimistic that vaccines will continue to be distributed, and they're making plans to be, to do whatever measures they need to do come late August, early September. We'll see what the situation is like, and if we still need to be masked, we'll be masked, and if we still need to be, small classes, they'll do that, whatever. But that's their plan. To be in person by September. I take it as they're giving us all a goal, right? We need, like I was saying before, we need to work together to keep these numbers low, to keep the spread limited, so that come September, Edgewood College and Marquette University can open with no hiccups. And I would imagine UW would also. They haven't said anything yet, but I would imagine UW will also be open in the fall. And that means all of our schools can probably be open by fall. Like, we can do this. And Edgewood and Marquette are setting the standard here to say it's time. It's time to get there. And we can get there. So that's all I have for you today. I appreciate your attention very much. I hope you have a wonderful evening. I hope you hit the share button and get the news, get this real news to more people. Disinformation, misinformation spreads on social media a lot faster than the truth does. So I need your help. So we're doing professional journalism. We're doing the truth. We're seeking the truth and reporting it. That's our mission. So anything you see, anything you can do to help us keep sharing this actual news is really appreciated. I would be back with the podcast tomorrow morning, and another update tomorrow at 4:00 right here. And until then, have a wonderful evening.
This is 365 Media.